Today we saw data from the NATALEE study, which is a large randomized study which compared patients taking an aromatase inhibitor with or without also receiving 3 years of ribociclib. And what we saw today was that younger patients, and this particular study was defined as less than or equal to 40 years of age, which is about 500 and so patients, seemed to have the same sort of tolerability to ribociclib if they were randomly assigned to that, compared to patients who were older, meaning greater than or equal to 40. And so the real take home from the data that we saw today is that all patients seem to benefit from the addition of ribociclib. I will also say that the hazard ratio was a little bit better in younger patients. The ratio was around 0.5 or so, which led to about a 5% absolute benefit. And for those patients who were greater than or equal to 40 years of age, we saw that that absolute benefit was about 3% with a hazard ratio of about 0.78. And so right now, ribociclib is not currently approved in early stage breast cancer. We're waiting to see if it's approved in intermediate and or high risk patients. But this does demonstrate that regardless of age or menopausal status, that patients seem to benefit, which is similar to what we saw in the monarchE study, which looked at abemaciclib for 2 years. And it's worth noting in that study, premenopausal patients, about 50% received ovarian suppression, as opposed to NATALEE, where all patients did. So to summarize, we still see a benefit regardless of age, and the discontinuation rate was actually a little bit lower in those patients who are less than 40 years of age.